I've asked for some questions to go up because it's been so strong in Ian's presentation and Sir Harry's, is given the values that underpin the people in this room, the quality of the work you do, some things you do will need to be kept the same because they're very important and not to lose sight of them. But some things will have to be different. And I'm curious about what they are. I don't mean tomorrow, I mean in time and over time. The other question I wondered about, because there seem to be some people here who are aware of the journeys that have now to be taken, that support on those journeys is actually very important, partly to avoid the blame, but also because nobody journeys well without those people on the way that give them warm harbour as well. So how might the sectors and organisations support each other through that transformation, through that journey? So just ask that question, what will you do that's the same and what will you do that's different? And the you might be you, the you might be your organisation.
Catherine McKinnon, Turning Point Scotland. I think it's a bit about focusing on the can do, not the can't. They're looking at the positive and the way forward. Sometimes when you get into change, people to what has happened and what did happen, but not to be ruling things out, to look at potential and can do.
Thank you, Catherine, which means making mistakes at times as well. Hi. And taking risks. Shall I give the mic to somebody? That would be terrifying.
I think for most of the people in the room, and it's been displayed today, the one thing they must always do that is at least the same is retain their passion. I think the minute we start to lose our passion, things can fall apart a wee bit, but you pick up there's a lot of passion in the room, so certainly maintain that at least the same level.
What about support? Especially across sectors, within local authorities, across local authorities?
Hi, in terms of support, I think one of the things that we've been discussing at this table today is around communication. Communicating within organisations, across organisations, about the good work that's being done. And certainly it's very difficult in the third sector where everyone's getting on and doing great work to take a step back and share the stories that are happening. And all I can say, being relatively new to this role, is that there are places that you can go to learn about good news stories and good case studies of work that's happening around health and social care integration, around reshaping care, both with the Alliance on the Alliance website and also on the Joint Improvement Team website as well. And you know, there's something there about getting the good news stories that you have out as well and communicating the good work that's going on in that way and supporting each other through communication as well.
I suppose I just had a thought about not defining that support agenda between ourselves, as it were, but thinking within a local community about what we can jointly invest in that community and kind of coming together around that. Was just my thought on that question.
Yeah, just going back to Mark's point, locally around some of the work we've been doing around integration, we had a big event in Ayrshire in Park Hotel about 3 months ago in August, and it was really people sharing what they were doing around the Change Fund, because sometimes people didn't know whether what North was doing that was different and stuff like that. And our three sort of chief execs from the interfaces that Marie included came and talked and provided input. But I don't know what Marie would say, but I thought it was a palpable energy in the room. I thought people were sharing loads of really amazing practice locally. I mean, we don't really almost have to look. I mean, it's good to look at national sites, but actually there's so much we can share. There's so much kind of really energy in the kind of change process, partly catalysed, I think, by the Change Fund, but not only. That we just need to kind of recognise what we're doing, almost give ourselves a bit of a pat on the back, which was kind of what we did on that day. This is darn good stuff. And just keep the thing going, keep the ball rolling, and I suppose not let the kind of big legislative programme and all that sort of stuff get in the way of what we're already doing.
I think my point is going back to the communication issue. It's not enough to keep communications going between all the parties involved. It's really, really important to get the communication going within the communities we work with, because I'm sure we've all had experience of people within these communities saying, well, I didn't know that was happening, nobody told me. You know, it's been in the papers, it's been on websites and all the rest of it, but it's really, really important to do that, because if we don't do that, if we can't bring people with us, and they're the people that we're supposed to be helping.
But Katrina's point also links with the earlier conversation about what about the lonely, the lost, that the people we don't know about, the elderly that are not in contact with services. Otherwise, it's the same old faces.
Communication obviously is extremely important. I think we raised that earlier. But the other key to any moving forward and meeting people's needs is listening. Listening is probably one of the most important things we can do, and that's not just us who work in the voluntary sector, but it's those people who sit at their desks and work out the policies and the strategies based on some of the communication and consultation they've had. It's a very long process, very long. Real consultation is about sitting down face to face with people and getting a feel of where they're coming from and what the issues are for them. So communication, yes. Listening, yes. At the same level of importance.
I'm Liz Roy, I'm from South Ayrshire Council Community Care. I think I'd just like to share some advice that a Director of Social Services in England gave, and that's about, as a council officer going into this, where I'll be meeting my health colleagues and people around the table, is let's keep the people at the centre and let's not lose sight of why we're there.
One of the things that's come through to me today and surprised me somewhat, but delightfully, is what will I do that is different? I don't know if it's different, but what I'll do more of is actually actively seek inspiration. Don't wait to be inspired. Try and seek it. And I found that today, if I can take 10 seconds, 20 seconds, in our own service recently, we've been kind of wondering why some things are kind of just no clicking and no working. And Harry Burns actually captured it for me today in the quote that he quoted from someone else. The quote he made of someone else is, "Stand in awe of the burden carried by the poor, not in judgment of the way they carry it." That's an insidious process that I think can get us all and can wear us down over time, but you might not actually recognise it. So today I came and I thought, I hadn't seen this guy for 38 years since we both worked in the West Infirmary, the old West Infirmary in 1975. And I says, God almighty, 38 years and I come along and you've inspired me in a way that surprised me delightfully. So I suppose what I'll try and do more of is actually seek inspiration, not just wait to be inspired.
Also, Sir Harry mentioned that one of the great ways of keeping resilient was hope. That it was hopelessness that bred burnout, that makes us bitter.
I'm Gwen Davey. I work for an organisation called Moving on Ayrshire. And we're person-centred counselling service. So I'm trained in person-centredness. And in this room, I've heard a lot of person-centred stuff going on today, basically because we all seem to be working from the social model. And I just wonder how we are going to change and challenge the medical model, which governs and is hugely powerful within what goes on. And that, I think, is the huge challenge for us, to change the way the medical model, who will use the term person-centred, but don't really know what it means.
Just in response, I think that's a big question, but there are signs of hopes, and in some ways, the model of co-production in health terms that we use around self-management is a thing called co-creation, where the physician, the consultant, and you work together in partnership. Now, we've been doing that in parts of Ayrshire over the last 3 or 4 years, and where the clinicians, and some of the interesting quotes are from the clinicians, I've had to give up power actually, and say, this person's got as much right to say what they think about their own care and what they want to do, their outcomes and so on. And that learning process has been fed into the national things, not least the Alliance. So in some ways, Ayrshire, in some conditions, for instance, COPD, has been ahead of the game. But I totally take your point. We've got, that's a tiny change, and we need to change the QE2 kind of thing. But I think that's going to be a fundamental. It's actually about a power relationship, which is why I think the human rights foundation might be quite pivotal, because it's about changing the way that those relationships exist, if you like. And that would be a challenge and a threat to a lot of people who have got little enclaves of power.
Just to strengthen what Phil was saying, we are currently running a person-centred care programme through NHS Ayrshire and Nairn, And the Health Secretary has demands on us that we do everything we do as person-centred by 2015, which is a huge ask, but we are working at it.
Mandy Yule, Ayrshire Hospice. We've heard a lot of interesting language today, words that either have a lot of resonance for us or perhaps they don't. But to me, we've also heard people talking about communication, which is, of course, where language sits. And I've had a bit of a light bulb moment, I think, in relation to the human rights discussion Phil just referred to that Ian was talking about. There's something about hanging your hat on simple language. And we have so much jargon in the system at the moment, in all aspects of our system, be we from health, the voluntary sector, or from the local authorities. And just those three words that Ian referred to, respect, protect, fulfil, that has such meaning. And if we as a system within Ayrshire could agree on a common language, it might be those three words, or it might be something different. It would enable us, I think, to communicate more effectively, more quickly, and also look after staff. Someone at this table is talking about how do we look after staff, because they are the ones who, with volunteers, need to be looked after just as much as the people we're trying to serve out there in our community. And there's something about having this common language, which I think I'm going to think a little bit more about. But if it tags onto human rights, I think that's a good place to start. So thank you.
Hello, I'm Marzie Stewart from Sign and Be Heard. I'd like to follow on from what you've said, because I formed this organisation to make a difference to people who have difficulty with communication. And anyone who, for example, has a deaf child, they don't pay to learn how to communicate with their children. So we're proud of that. We also don't need class sizes of 14 in order to run a class. If we can pay the venue and the lecturer, we do it. One thing that I've been trying to do, and talking about inspiration, I think CPD training has a budget, and by law the teaching staff need to train for 35 hours a year doing something. We've created courses which last 20 hours for an accredited course, which used to be 40, and we've had approval for that. Or we could put together something for that target audience, so that, God forbid, if you've got a profoundly deaf child at school just now, that child's great, it's only deaf, it can go to a mainstream school, but who signs, who communicates with that child? Now, I've done a lot of voluntary work. Teachers have had to have extended playtimes because they've witnessed the children they then have taught go to the boy in the playground who for 5 years didn't involve himself with any of these other children. They've watched a child go up and say, "My name's Tom." The deaf boy is delighted. Next thing, the deaf boy is playing football with all the other children. And it's such an emotional thing. That's all that's happened to make inclusion, which is the big word, underlined twice in my notes. And I just think, it's surely a basic right for these children to have communication for themselves in school. I know how I felt. I'm a mum of 4, and every time one went to school, my husband used to despair, because I would be in a state when I got home, because I'd say, "Oh, she didn't want to go," or he wanted to go, and he said, "Well, you're never happy, are you?" But they all had all their faculties around them. They could communicate effectively. If they were profoundly deaf and they had a woman my age to support them for 40 hours a week, I'll tell you, it wouldn't be good enough. So hopefully something will be done somewhere to effect this. Thank you.
Thank you for that continuing conversation about communication, which is important, but also not only for young people who are deaf, but also for everybody, and for staff to have that facility that they can do the right things.
I've done a lot of voluntary things throughout supermarkets in Scotland, from as far north as Elgin right down to Dumfries. And deaf customers who were missed before have now applied for jobs because they know they've got people there that could communicate with them. So it makes a difference to them as well.
There's an economic advantage too.
Yes.
The theme that comes from that, both Mandy and your conversation, is how to support staff. So it seems to me not unimportant that staff will find this at times some of the hardest steps. Giving over control, power, not knowing outcomes, not feeling professional. Are there ideas about how to do that?
Hi, I'm Margot Taylor from South Ayrshire Choose Life. I'm the Development Officer. Just to kind of make a comment around that, is that I'm actually I'm employed by the NHS, but then I also experienced chronic fatigue at one point, in depression. and by my employers it wasn't really handled particularly well. So from my point of view, it's like, you know, if the statutory or the employers can't get it right, then how do you get it right for service users and whatever? So yeah, so I think that point about staff, you know, is really important. You've got to kind of start from within before you can do anything really useful externally.
Just in terms of a plea, I suppose it's about keeping communities in the loop and remembering that there's a lot of assets in communities, and if we get, Harry Burns was talking earlier about making connections in communities, and I think sometimes a lot of unintended outcomes come out of that are actually very, very beneficial for people, because I'm thinking about a story that we heard in a recent, fairly recent training around asset-based work, and it was about someone describing how their brother had a befriender who was assigned to him, but when they sat down and spoke to the young guy, that he wanted a real friend, he wanted his own friend, he doesn't want someone given to him. So I think that was a big lesson, a light bulb moment for me, that by making the right connections in a community, you can actually create a safety net in a community that's right on your doorstep and probably doesn't need to be commissioned or designed or delivered, and it's about unlocking some of that. So in the process of integration, I think remember communities and remember the assets that are there, and how can we support that to happen naturally in people's localities.
It seems that one of the things, there's not only the richness of experience, but one I've been struck with as a thread all the way through, and Ian picked it up, which is some of the soundest ways of working comes from your own experience, from knowledge and knowing how it is to be included, excluded, communicated, not communicated with. It may not be you, but it may through your family or friends. It's knowing how it is for real for people. And therefore, for me, one of the things that will keep hope and maintain resilience is what you've got on both sides of the room. Never forget the people. And that those people are you.